Department.
We can hear you. Can you hear us, Doctor?
Hello, Bruce.
Bruce, can you hear us?
How's everybody doing?
Getting used to things.
I can only imagine.
Yeah. This is Doug Bonebreak. I'm one of the city councilors.
Hey, Doug, how are you?
I'm doing all right, sir. Thanks for asking.
Good.
I know you're busy. I know you're a busy
We all
guy.
are.
Thanks for being a part of this.
Absolutely. Whatever I can do.
This is the first time we've done teleconferencing, Bruce, so it may be a few minutes before we get all the bugs worked out.
Hey, not a problem. I mean, this is everybody's new normal, so it's all good.
If we speak up,
Yeah.
we should be able to hear it. Hey, Doug and Dr. Dart, can you hear us? Doug or Dr. Dart, can you hear us?
I can.
I can.
This is Dr. Dart.
Okay, good.
This
good.
is Doug.
Yep, just checking.
Thank you.
Okay, it is 4 o'clock. We'll go ahead and call this emergency meeting of the Owasso City Council to order. Item number 2 is roll call.
Mayor Chris Kelly.
Here.
Vice Mayor Bill Bush.
Here.
Councilor Kelly Lewis. Here. Councilor Lyndall Dunn.
Here.
And by teleconference, Councilor Doug Bonebreak.
I'm here.
All right, well, first off, I want to thank everybody for making time to be here. I don't know that every citizen understands or knows that we have full-time jobs, and it's sometimes hard to get everybody to drop everything and come in, but this is for an important reason. I appreciate everybody being here. I also want to thank the city staff for all the hard work you've put in on this as well as the citizens that are both here and tuning in through video. This is the first time we've done this, so bear with us if we have any technical difficulties. And speaking of the citizens and the amount of people that are here, Julie, I was wondering if you wouldn't mind taking a minute kind of explaining what the current rulings are kind of on open meetings and how we're supposed to do this during this unique time.
Mayor, this is a bit of a hybrid meeting that we're holding today, which is what a number of cities have been trying to do. As you're probably aware, the Oklahoma legislature made some very quick and emergency and much needed amendments to the Open Meeting Act to allow councilors to be present in the meeting by audio or by teleconferencing or by video conferencing. But that, of course, leaves us with the question of if one or more members of the council is video or teleconferencing, what about public participation and input? At this point, we are doing what the vast number of larger cities at least are doing, which is allowing video and teleconferencing, but in the audience attempting to be responsible and adhere to the health department and CDC regulations and placing chairs no closer than 6 feet together. Of course, this results in a very limited number of chairs compared to what we would have on a normal council meeting night. And those citizens may participate in the meeting by either submitting their questions or comments to the city clerk before the meeting, and we do have a number of those that she will read into the record at some point, or following it on the YouTube Live. So there are various options that may change in the future, but at least for what we're doing today, we're in compliance with the Open Meeting Act and trying to be socially responsible as well.
Okay, thank you, Julie. So just a little recap as to why we're here or how we got to this point. On March 6th, Tulsa County had their first positive case of COVID-19. The first 3 cases were all determined to be travel related. The first documented case of community spread didn't occur until March 17th, and that's significant because that's when we called our first emergency meeting. On that day, March 17th, the council passed and I signed a resolution 2020-10 declaring a civil emergency in the city of Owasso. The very next day, Dr. Bruce Dart, who's with us today and will speak to us in just a minute, the executive director of the Tulsa County Health Department, sent out a letter recommending closure of local bars, restaurants, movie theaters, gymnasiums, and other entertainment and food service venues. Upon that letter, we called another emergency meeting for Friday the 20th. In that meeting, this council passed and I signed a resolution 2020-11 limiting and closing certain commercial businesses due to the COVID-19 pandemic. On Friday, March 20th, on March 24th, I called another special meeting to discuss and update Resolution 2020-11. 2 hours prior to that meeting, Governor Stitt mandated safer at home for vulnerable populations and closure of non-essential businesses. And because of the governor's order, we took no action at that meeting. Since that meeting on March 24th, several cities, including Norman, Tulsa, Oklahoma City, Jinx, and I know Bixby is meeting now or has already met, have issued broader safer at home orders. So we're here today to discuss if Owasso needs to take any further action than the governor's mandated up until this point. So the way this will work, counselors, much like the last meeting we had, we're going to hear from Dr. Dart, and then we will have a Q&A with Dr. Dart, and then we will hear from citizens, both emailed questions as well as anyone in person that wants to speak, and then we will deliberate after that. So Dr. Dart, can you hear me okay?
Yes, I can. Thank you.
Okay, you're up. If you want to go ahead and make a few comments, and then if you have some time, we'll fire some questions at you. We really appreciate you being here. We know how busy you are. I can't say enough about how invaluable you've been during this process. I've said it many times. You're our Dr. Faust here in Tulsa County. You've just been a go-to guy for all of our questions and have really guided us through this. So you have the floor, sir.
Well, thank you, and you're all very kind. And in all honesty, really the real heroes here are all of you who have to make these really hard decisions. And I don't envy you that your positions, but just to give you a little update on where we're at. This morning at 10:30 on a partner call, we reported in Tulsa County that we had 83 cases. By 12:45, we're up to 101 cases. Statewide, we've got close to 600 cases. We've had about 23 deaths. And unfortunately, our country, the United States, continues to have the highest number of reported cases in the world. We have over 164,000 cases now nationwide. We've had over 3,100 deaths nationwide, which, our death rate is higher than what we're seeing globally. There's over 800,000 cases worldwide. So, the actions that are being taken, as we talked about before, to really strengthen our ability to break the chain of transmission are keeping people apart. And, I actually went out and went down Riverside Park Sunday just so I could see if people were listening, following direction. And frankly, we have to do a better job as citizens to take responsibility to maintain some distance between one another. We've been doing some modeling that shows what our projections could be if we don't start to break that chain, and it's going to ramp up and overwhelm our hospital system if even with the recommendations that cities are making, that people have to take the responsibility and follow. So I think the more that we can require and ask people to not gather, or at least stay apart, even in those public spaces like trails, and make sure that they educate themselves so that we can maintain some distance to break the chain. The circumstances we're in right now will be much shorter, whereas if we don't, we're going to be in business closure restrictions for a much longer period of time. And so this is another hard conversation, I know, for you as a city council and for your mayor and your city manager. And I know it's not easy, but our numbers are going up rapidly, and especially as we start to ramp up our ability to test even more, we're seeing more cases, which is to be expected. Our hospital systems now are really feeling the surge and the brunt, and we've got to get people to separate. We've got to get people to stop coming together in ways that promotes transmission of this illness. What we can do to make that happen, I strongly feel that we need to do it.
Okay, thank you, Dr. Dart. Questions or comments from the council for Dr. Dart while we've got him here?
Doctor, how many deaths do we have in the Tulsa area right now?
We have 3 so far. What we're seeing that we do have a couple cases that we know have passed that we're still waiting for results on. We haven't got those back. We have 3 confirmed right now.
Dr. Dart, this is Mayor Kelly. I saw on your website this morning that the total number of cases, at least that have been tested, was 540 maybe on the website. But 177 of those were hospitalized, which by my calculations is about 31%, which seems quite high. Is there a statistical anomaly there, or are we really having that much difficulty?
No, that's right now, that's very accurate. And I think it's just a combination of people who have other underlying health issues that are getting sick. And it's not that COVID by itself is putting them in the hospital, but COVID in combination with their underlying health conditions are putting them there because they can only be treated in that space. So, and we know we have a lot of risk here in Oklahoma and Tulsa County with people that deal with diabetes, heart disease, lung disease, kidney disease. And although, that data is showing that people are actually getting healthier here, which has been, we just received word last week that we've gone up in county health rankings. We're actually the 12th healthiest county in Oklahoma now. We were 28 10 years ago. So people are doing great things to improve their health status, but yet, because of COVID, we're still seeing that high hospitalization rate.
Sure. Dr. Dart, when you spoke to us first about 10 days ago, one of the issues you talked about was our limited ability to test people. Has that been alleviated, or are we still pretty restricted in how many tests we can provide?
It's getting better. We're actually starting to see, and here's, I guess, part of the problem. We are starting to see labs that have a growing number of test kits. So even though we're nowhere near where I would like to see us in terms of overall testing, we have more supplies than we did. But what we're still lacking is the supplies to collect samples and to transport samples. So hopefully those supply chains will continue to bring resources here. We are seeing more test kits, but we still, as of last week, we only had 40. This week we have 100 test kits at the health department. Labs are seeing more, but we don't have the viral transport medium to put swabs in to transport them to the labs, and we still have a huge shortage of swabs. So hopefully in the next couple of weeks that will start to change. But right now it's still an issue that we're very concerned about.
Dr. Bart, this is Bill Bush. I know up to this point, we have recommended, and all across the country, they're recommending the 6-foot distance. But as I was walking out the door today, there's an MIT study, this was just like 35 minutes ago that I heard this. They're saying that the particles can disperse up to 27 feet. Are they still recommending the 6-foot distance from each other? And if so, where did that 6 foot come from?
And so, and they still are, and the CDC hasn't changed that guidance, but as you know, with coronavirus, the guidance does change regularly because we're learning more and more about this virus as time progresses. Originally, it was that 6 feet came from really how far people emit droplets when they cough. And it's generally in that 3 to 4 feet range. And so when they talk, I think the MIT study you referenced, they're starting to see or find out that in some cases, usually when people cough, the virus is in their droplets, and those droplets are somewhat heavy until they fall. We're starting to see now that the virus the particles can become more aerosolized. So they kind of hang in the air a little bit longer than what we had previously thought, kind of like measles, which means that because they're hanging in the air, the ability to be infected with those aerosolized particles is greater, and that's why they're talking about these greater distances. So still learning more and more about what the factor of aerosolation in coughing and sneezing truly is. But if that turns out to be true, that's gonna, I think, ramp up our concern because it's gonna make transmission much easier.
Dr. Darts,
Dr.
Mayor
Dart.
Kelly again. Oh, go ahead, Doug.
I was just gonna ask on the issue of personal protection equipment for healthcare workers, have you had any feedback on that? Is that improving, or are we in better shape than we were last time we visited?
So we just had, yesterday, the Oklahoma State Department of Health released their final shipment of supplies from the Strategic National Stockpile. So we're in much better shape than we were last time we talked. But we still know that the manufacturers still cannot keep up with demand. Supply lines are still being disrupted. So while I feel much better, we go through these supplies really, really fast. So we have to make sure that both our manufacturers and our supply lines continue to function as high as they possibly can, because if we go back to where we were 2 weeks ago, we're going to be a world of hurt. But that at least is good news to say that it's not as bad as it was, and hopefully manufacturers are truly ramping up. So that's one part of this story that is much more positive than it has been.
Okay, thank you.
Dr. Darts, Mayor Kelly again. Pertaining to the governor's mandate, and then we've had a few other communities since that kind of go over and above those orders. The governor mandated that the Safer at Home apply to those at high risk, and we've had a few other communities extend that out to everyone, as well as some closure of some parks, and I think we already had established no gatherings of people over 10. So I'm just curious at this point, pertaining to those specific items over and above the governor's mandate, what does the Tulsa County Health Department recommend? What do you recommend at this point pertaining to those items?
You know, so nationally, we've got 32 states that are now under stay-at-home or shelter-in-place orders, and that's because we've really seen a ramping up in positive cases, which we've seen that here as well. And we really support being stringent and being aggressive around this issue right now. And if we can do this through, I think the president extended his orders till April 30th. If we can at least extend shelter-in-place and stay-at-home orders and through April, we can get a really good feel and get great data that tells us if this is working and if we're starting to see that break. And so we strongly support it at the health department. We know that there's no other mechanisms now to prevent transmission, and as long as people are coming together and violating the stay-at-home or shelter-in-place, we're going to continue to see cases. We're going to continue to see people dying, and we've got to get people to basically stop coming together. And I know we've been messaging that. All your city leaders, city council has been doing the same thing. Somehow we got to get people to connect to the message, or this is just not going to stop.
Yeah, I agree that the messaging has been consistent and it's been strong. But one area that I probably get the most comments from citizens is in relation to the big box stores and the gathering that happens there. And at the same time, we're not seeing much in the way of limitation there. So I'm curious what your thoughts are on any methods either that the big box stores can take or that we can take to kind of limit that if you think that's an issue. I've heard several things from just emphasizing to folks that only one person should go do the shopping and only if necessary. I've heard also limiting to 25 people or less in those bigger stores. What are your thoughts on that?
And I completely agree with that. We don't need the entire family going to the store like we've seen in the past. And these big box stores are large enough. I'm starting to see where some stores are actually taping pathways on the floor so that people know where they can go, they know where they can stop, so that they can keep that 6-foot distance between themselves. And I think that taking those kind of aggressive actions are really smart because I don't want to see these businesses completely shut down, and the public needs the material that they get from there. And so they can take action to keep their customers safe while they're there, especially in those larger stores that have a huge footprint. So limiting family members. I mean, you're right. I mean, we would recommend the same thing. All we need is one family member to go to the store, and then stores really taking ownership of how their customers are allowed to conduct themselves in the store, maintain distance, putting up whether it be tape or other barriers to keep that distance between people and keep that physical separation there. So in lieu of just shutting them down, you know, if we could get everyone to follow these recommendations, we can at least maintain some economic viability. People could still get material they get without increasing that risk of transmission.
Yes, I agree. With regards to parks, I know some communities have shut down their parks. Yeah, we've had some citizens that have commented on this, and some of the comments we've got centered around wanting to get out and exercise, and that's actually been recommended. What would be your opinion with regards to parks? Is the recommendation from the Tulsa County Health Department to do a full shutdown of parks, or it seems to me like the problem area would be potentially the equipment that multiple people would be using? Would it be a savvy approach to encourage people to get outside to the parks, stay in small groups, but not use the equipment, or do you recommend shutting down the parks completely?
You know, I like to see the parks stay open because people do need to get out of their home. I mean, if we keep people locked up in their house 24/7, we're going to have a lot of other issues in addition to COVID-19. But I do recommend taping off the playground equipment so people can't get to them, because you can't be there cleaning and disinfecting the equipment all day long. But if we, I mean, you know, I'm telling people, go to the trails, go to the parks, stay away from equipment, don't get on that, maintain that separation between you and whoever you're there with, stay in small groups. And if we get people to do that, it at least will support their emotional health, their physical health, and still be part of the solution to breaking that chain.
Great, thank you, Doctor.
Dr. Dart, do you feel the same about golf courses and tennis courts?
Yeah, I do. In fact, I've gotten a lot of emails from here because I recommend that tennis courts be shut down because of the interaction and the fact that people are constantly touching surfaces and so that it does not break the chain of transmission. Golf courses, I haven't been as forceful about, because golf courses, you know, I'm very clear about, if you're going to have carts, there should be no more than one person in the cart. It'd be better if they had no carts, to be honest. They have to manage their clubhouse where there are only one or two people in at a time, because those are a much smaller footprint, and it's hard to keep people distant. So, you know, and golf courses, they're not on the essential business list to stay open, but I think it's just part of the emotional and physical health that if they do stay open and they follow some pretty strict guidelines so that people aren't engaging and aren't coming close together, I think we can still manage to have them up and operational. But the second they stop following the recommendations, they're going to have to be shut down, because if they prove to be a focal point of chain transmission, we'd have the choice.
Dr. Dart, one more question regarding hospitals and such. Have you had any feedback from our area hospitals of any one of them being overwhelmed with cases, or just in general having to deal a high intensity of the COVID virus?
You know, as far as patients, they haven't experienced a surge capacity yet, but what they've really experienced is the issues around PPE or personal protection equipment, and making sure that they have enough, and they're very concerned about their supplies and their stores running low. The main concern is that if a healthcare worker has been exposed to a COVID positive patient, they have to quarantine that healthcare worker so that they're not able to be there and serve their patients. So they've been really good about putting infection control protocols in place every day, regardless of who they're seeing. But our healthcare workers are kind of being overwhelmed, because if they have to remove people from the front lines, that burden falls on the people who remain, and physically, emotionally, that's incredibly difficult. So we're working very hard to get them at least the PPE they need so that they can keep themselves protected all day and reduce exposure to positive patients even when they're dealing with a patient they don't know it's positive. So they're taking all the right steps today. You know, we have some models that we forecasted out what will happen to our hospitals if people don't continue to stay apart and break that chain. And it's, you know, and they're purely, these models are created through analytic models that are purely predictive, and we have to make some assumptions in order to do it, but if these models come true, that yeah, they eventually will be in a world of hurt if the transmission rates continue.
Thank you.
Speaking to those models, I don't want to put you on the spot, Dr. Dart, but I know you've been looking at this really closely. For some of our citizens that are listening or watching, what does this look like, your best estimate? What does it look like, case numbers in Tulsa County in 2 weeks and again maybe in 4 weeks?
So we basically have these three models. One's kind of an optimistic model, one's more pessimistic, and then we have an in-between. But in-between model that's kind of in the middle of the range between really optimistic and really pessimistic. What we're looking at, what we want, so we have this value that we call RO or R naught, and that just means reproduction. So that one person who's infected, we assign them a value of 2.4, which means one person can infect 2.4, 2.5 people. So and we were working really hard in reducing that R value. And so as of March 20th, we had that reduced to 2.2. And we're factoring, if we continue, our best case scenario, we'll have the R value reduced to 1.4, which means that one infected person can infect like 1.5 people. But so in this model I'm talking about, we look at new infections will peak probably around June 8th with over, off the top of my head, about 33,000 new infections by June 8th. Hospitalizations will peak a little bit later on, around June 24th, with over 9,800 people in the hospital. And that's really assuming an optimistic 4-day hospital stay, which most of our hospitalizations are longer because of the comorbidities that people have. And that's really kind of looking at a pessimistic 50% hospitalization rate. And new infections won't drop below 1,000 per 4-day period until like July 26th. And using the same model, on July 30th, we'll drop below 1,000 hospitalizations. So cumulative infections will top out around 350,000 by July. Deaths top out at just over 3,100, and that's using like a 9% fatality rate, which actually could be optimistic. So that's the in-between model. The optimistic and pessimistic models have different ranges, but we'll probably experience something closer to this than we would the opposite end of both ranges.
So
if that makes sense.
Yeah, no, that makes great sense. I appreciate that. So to run that data out and to kind of answer now what the viewers that just heard that are thinking, you know, the recommendations that you're making as far as you know, safer in place and the social distancing, is it safe to say that this is going to continue on for a couple months at least?
Oh, absolutely. I think we'd be overly optimistic to say it wouldn't. So, I mean, just because of the way that the pathology of this disease and how people keep coming together, as I said, this is projected through June and July, and that's when people start to social distance. So if they don't social distance, it's going to last a lot longer.
Thank you. Just trying to create expectation for those who are listening at this point. Okay.
And I do want to just want to say again that, you know, these models are based on several assumptions we had to make because we don't have the ability to do widespread testing now. We don't really know the true numbers of people who are infected. So just as a cautionary tale, that we're assuming certain things. Later data might change those assumptions, but this is where we are today.
But I'm still under the assumption that we still have not been able to test near what we want to. So the numbers that we're seeing as far as our current death rate, even the hospitalization rate, those are based on low numbers of tests. We still haven't tested all near to the capacity that we wanted to. Is that correct?
Oh, absolutely, and because it scares me that, like, right now, our national death rate is around 1.93%, which is extremely high when you look at flu being only 1/10 of 1%, and that's based on the numbers we're testing. Now, we start testing more, those numbers, those death rates, things like that will definitely go down, but people are still going to be dying, and that's really the critical thing.
Sure. Okay. Anybody else have questions for Dr. Dart? Well, once again, the work you're doing here is, I know you're working long hours, and you're doing an incredible job. We appreciate you making the time to be here. I think this is part of that important work, educating the public, because there's a lot of misinformation out there, and you tell it like it is, and you tell it factually, and I think people need that right now. So thank you again for being here.
Well, thank you so much for giving me this time, and thank you guys for all you're doing. Here at the Health Department, we appreciate y'all so much.
All right. Thank you.
Thanks, sir.
You bet. Bye-bye.
Bye-bye. Okay, so now we're going to move on to Julie. Do we want to hear the emails that were sent in by citizens?
Absolutely. I've got 7 here. The first one is Adrian Lonsinger. I hope I pronounced that correctly. To my government officials, please issue a shelter-in-place order to follow suit with Tulsa. Our lives are very intertwined with Tulsa, as there is hardly any separation between the two communities anymore. When one drives around in Owasso versus Tulsa, there is a stark difference. Tulsans are taking this seriously while Owasso residents are not. As well as Tulsans bent on breaking the rules will simply come to Owasso. We do not want to become the New Rochelle of Oklahoma, as it would forever stain our reputation. We are currently seen as a clean, safe suburb of Tulsa for young families to grow. Please don't destroy that as a result of poor decisions out of pride and ignorance. We need action now. A week from now will be too late. I urge you to issue a shelter-in-place order for all Owasso residents effective immediately. The second is a phone call taken from a Home Depot employee. People are using Home Depot as a meeting place or hangout location with no regard for social distancing, and I am afraid that I will take something home to my family. Please consider the following: enforcement of no gatherings of groups of people in these businesses that are allowed to stay open, limiting the types of items or the number of items that can be purchased to essential items only, and limiting the number of persons allowed inside an essential business at one time. The third is from Carrie Bayer. I understand everyone is home for the most part right now, which leads to more trash than normal. Driving around my neighborhood seeing so many extra trash bags is disturbing. What's more troublesome is watching our trash men having to touch all these plastic bags. This virus lives on plastic for 3 days. Why are we making them touch these bags? They shouldn't have to leave their trucks right now. So my question is, are these men getting extra pay for doing this because they should be? And if they're not, can you make it free to take our extra bags to the recycle center for now to help protect our city workers? Thank you for your time. The fourth one is from Rosario Sloma. I wanted to see if this is possible. I would like them to post or discuss the details of what businesses can and cannot have curbside pickup, be open, have limited hours if they are talking about putting a shelter in place. I understand food, but there are plenty non-essential businesses not open but still offering those services. There are a lot of small businesses that are confused, and I know friends who are worried they may get fined because they are not sure. Please post fines, if any apply. The order in Tulsa is clear as mud, and people still do not understand the difference with a stay-at-home order versus a shelter-in-place order. I look at other cities that are very clear and have full explanations on what is considered essential versus non-essential. See examples of the FAQ section of this city's order. It may seem silly, but seriously, people are so confused and are not understanding the severity of the situation or what these orders mean. Thank you. The next one is Connie Gowen. I am wondering if our Owasso hospitals are prepared for the COVID-19 cases, especially severe cases. I have heard that they are not, and those severe cases would be sent to Tulsa hospitals. This could jeopardize a person's life and overwhelm these Tulsa hospitals. There are shut-in residents or very vulnerable residents that need help with picking up necessary items. They may not be able to buy online. How about having a dedicated phone line for groceries? They pay over the phone. Have volunteers who have been screened to pick up these items and deliver directly to these individuals. The next comment is Wendy Wilson. I would like to know why places like Lowe's and Home Depot don't limit how many people are in the store at a time. I drove by Lowe's and the place was packed. That just seems so unhealthy to me. There is no way people can be social distancing with that many people in the store. The state cannot control this outbreak if we can't keep people away from each other. I would like the city to restrict the number of people they allow in. If we make it a little inconvenient for people, they will not wait in line to go in just to browse. People are bored and they are just going out to the stores that are open. People that are out can be carrying the virus and not know it. So to slow the spread, we need less people out and about. Even places like Walmart and Sam's should have limits too. The final comment is Heather Hoy. Due to the rising number of cases, I believe we should step up and lead the state in implementing a stay-at-home order. Hopefully others will soon follow. I believe the state has been dragging their feet when it comes to protecting its people. Here are a few questions I'd like to see answered. Can we implement a stay-at-home order for Owasso? Are Owasso hospitals prepared for a surge in COVID-19 cases? In the case of our healthcare system becoming overwhelmed, would Owasso consider calling for volunteers with previous medical experience to help out? Stores are becoming overwhelmed with online orders, with not enough staff and supply to fill demand. Is there anything we can do about this to encourage more online ordering? How can we stop unnecessary loitering and shopping at stores such as Walmart and Home Depot? What is the city of Owasso doing to help with mental health during this time? I believe parks should remain open, but playgrounds should be closed. If parks stay open, we need to make sure that people are still distancing themselves and that there will be consequences if they aren't abiding by the rules. Golf courses can remain open, but no use of golf carts. Thank you. And that was the last comment.
Thank you, Julie. Is there anybody here that's signed to speak?
Yes, sir. Trevor Wells?
Welcome, Trevor.
Thank you. I think that my main question about Big Box Retail will be answered shortly, but one thing that I did want to know, has there been any positive cases of COVID-19 in the city of Owasso that anybody's aware of?
No.
That's it.
Can somebody repeat the question? I didn't hear it.
I was wondering if anybody knew if there was any confirmed cases of COVID-19 virus in the city of Owasso.
The St. John Hospital handled a Collinsville resident, and who I believe has now been transferred to St. John Tulsa, and St. John also handled a Skyhook resident who has been sent to St. John Tulsa. Those were confirmed cases that came through Owasso, but I'm not aware of any Owasso citizens or residents that have been confirmed for COVID-19.
Okay, thank you.
The second is Eric Miller.
Thank you, ladies and gentlemen. Just a couple comments and then a question. I listened to the doctor talk about going down river parks and seeing all these groups. I just urge you not to jump to conclusions. My wife and I, we share a house, we share a breakfast table, we share doing dishes, and you're going to see us walking side by side down the park. If my son and daughter were with us, it'd be the same thing. So don't jump to conclusion that all these people are in groups that don't live together, aren't family. Just be careful about jumping to conclusions. And you touched, somebody did it here, or maybe the doctor from THD, there's a real downside to people keeping them cooped up. I have not seen any of the press in Tulsa talk about it, but the ABC affiliate in Dallas ran a pretty good sized story about the huge surge in domestic violence cases that's going on here. So there's definitely a downside by keeping people cooped up for too long. And there's a balance. I don't know what that balance is, but there's a balance with all that. Divorces and maybe the upside is all the number of babies that'll come along too. And before I get to my question, I really hope that you all make decisions based on data and good data and good statistics. There's a lot of bad statistics out there. Rather than make decisions based on fear. There's a lot of people that are very, very afraid. And unfortunately, I feel like our media is trying to get the eyeballs, trying to get the listeners, trying to get the readers by running these sensational, fear-based stories. And I don't think they're doing anybody any good. I don't see any good data. I don't see anything encouraging. I don't see any facts. I just see a lot of subjective words being used that all spell doom and gloom. So I hope y'all use good data to make your decisions. Now my question, what is going to be the condition, what are going to be the criteria that you're going to use to decide when to retract the restrictions? You're going ahead, you're setting up restrictions, it sounds like you're considering more. You've got to be thinking about when do we call them off, what do we call them back? And it's your decision. You might ask for advice from Tulsa Health Department, but you are our elected officials. You are the ones who are imposing the new restrictions, not THD. So you folks need to be the ones to decide, here's what we're looking for when it's decided time to relax the restrictions. Thank you.
Thank you.
That was the final speaker.
Okay, so I am now going to throw it over to you, Warren. See if you have any comments or updates for us.
Thank you, Mayor. I have a great deal. Dr. Dart went over the numbers. I appreciate the citizen comments. I certainly can appreciate those here in person. Excellent points. In terms of some of the ones that were sent in through email or social media, certainly you're aware that there are items that we don't have jurisdiction over. You know, the preparation of the hospitals is not something that we're in any way involved in on a day-to-day basis, nor do we have any authority to tell them how they should be preparing or whether they should be recruiting volunteers or anything like that. The question about mental health, the city of Owasso doesn't have a mental health department. That would be more toward Tulsa County, their health department, and the state of Oklahoma when it comes to addressing mental health. There were a couple of other, a dedicated phone line for groceries. Again, that would be something the private sector would do. So I think that was the limit of the comments that are completely out of the city's purview. In that, staying in that light, I don't want to add to Dr. Dart's numbers. We know what the numbers are. 565 cases today, up from 481, 83 in Tulsa County, now 101. I said I wasn't going to add to them, but I just repeated them. But that's where we are. In terms of the city's focus, it hasn't changed. We really have somewhat of a three-pronged focus, and that is to try to continue to provide uninterrupted core services. That's our job. From a City of Owasso standpoint, from an organizational and operational standpoint, it's our job to continue to provide uninterrupted core services at the highest level possible, regardless of the outbreak. Everyone in this room understands that we can't close the police department. We can't close the services of our fire department or EMS. We can't close water, wastewater, stormwater, all those things that we do. Even some of the what might not be seen as quite as important as those services. Our citizens depend on services from our finance department, our community development department, our parks department, even our golf course, as has been discussed. So it's not an option for us to close. So our second focus is limiting the exposure of our people to the virus and keeping them as safe as possible. Obviously, it's an emergency situation if too many of our police, fire, public works workers are exposed. So we're doing everything we can every day. I could give you a long list of the things that we're doing to limit any types of meetings, to do shift work, to do remote work, and I've talked about those in the past. And if you have questions about that, I can answer them. And then finally, providing our people with the PPE, the personal protective equipment, and the resources to protect themselves and serve the citizens. That is really the limit of what the city does. Now, I understand you as elected officials, you're trying to make difficult policy directive decisions, and we will continue to research information for you. We'll continue to implement those operationally those policy decisions that you make, but that's really our focus right now. And then, of course, financially, we will deal with whatever comes. I mentioned last time we're in good shape financially, well ahead of the budget for this fiscal year. Owasso is in a situation really the envy of a lot of cities and towns, because we're very strong financially. How long we could remain that way if everything completely goes downhill, we'll see. I don't know that anyone anticipated the severity of something like this that could happen and within 30 days change all our ways of life. Other than that, we've had some churches offering different types of services and facilities. We're communicating with the hospitals on a daily basis on items like that. We're communicating with all city businesses on a regular basis to try to help them with more creative ways of doing business and encouraging them to social distance and to take some ownership over their customers and how they do business. And I'm tempted to get into our different form of government, council manager form of government versus a strong mayor. The fact is, in our form of government, we can't have one person make a decision and then do an announcement and just react unilaterally. It depends on our 5 councilors who are present here to make these decisions and move forward. As the mayor alluded to, these are all private business people that are still getting paid $0 for this volunteer service. So I want to take this opportunity to thank you for being willing to meet for so many special meetings and emergency meetings, and I'll conclude my report with that.
Thank you, Warren. Well, councilors, we're at the point now where our job is to deliberate upon the facts that we just heard from our health department, as well as some of the comments from our citizens. If you remember the last time we did a meeting like this, this one we just take up the things that we've heard and discuss the individual items. We do not need to take action at this meeting. As a matter of fact, if we come to some consensus as to any changes that we need to make or want to make at this point, then we'll call a separate meeting, get together some language, and then come back and vote on that. Probably tomorrow would be my early thoughts on that. So at this point, I'm going to open up the floor to the council to comment on any of the items brought up by Dr. Dart or our citizens.
I had a question before I make any comments for Warren. Can you kind of go over what you may know or can communicate as far as there was one issue that was talked about a couple times regarding parks. What have we made any changes to how our parks are operating, and include the golf course, if you wouldn't mind?
Thank you, Councilor, for that question. Yes, we've made several adjustments in how we operate. We were fully aware. Start with the parks first. Certainly, Governor Stitt's order included parks and golf courses, public and private, on his, I guess you could call them essential businesses list. And there have been some good points made. People do need the ability to get outside. So we would concur from a staff standpoint with the need to keep those open and have an outlet for people for getting outdoors, exercise, mental health, so on and so forth. As far as parks, at the time, on the day that the Tulsa mayor decided that they would cordon off their parks playground equipment, we decided to try to go the extra mile and have parks employees and police monitor the gatherings. Now, obviously, we can't monitor the cleaning of the equipment. We can't clean the equipment enough to assure anyone that it's going to be sanitized equipment. I look at that like I do social distancing. I think that's the responsibility of the parents and the people. I realize, you know, not every kid out there, maybe in a park, is with a parent. But if you're taking small kids to the Splash Pad at Rayola Park, for instance, it's up to the parents to maintain social distancing and watch over their children. I hate to close something as busy and active and that brings as much recreation as a splash park or a piece of playground equipment. I'm envisioning again those parents having a responsibility, and this is a lower risk population that's playing on that equipment. So what we've done is more frequent cleanings of the park restrooms. We have utilized our parks employees to help the police monitor so there's not close gatherings of people. We're asking them to maintain social distancing and using as leverage the fact that if we can't maintain proper social distancing, we will have to turn off the water to the splash park, for instance. We will have to cordon off playground equipment. So that's what we've been doing from a park standpoint, along with normal maintenance. From a golf course standpoint, I should have, the Inside Owasso story yesterday, I believe, was a good one, but our Recreation and Culture Director and our Director of Golf, Corey Bird, they've instituted opening doors, less touching of equipment, increased sanitization, allowing and encouraging single rider carts, closing down the dine-in area as far as the food and beverage side of it. They are takeout only and doing everything they can to encourage people to be responsible in utilizing the golf course. So those are not all of that's being done, but some of the things being done in an effort to keep our parks and golf course safe.
Okay, thank you. That's good information.
I found it very encouraging. Again, I appreciate Dr. Dart so much, but I found it very encouraging that he was supportive of the golf course if it's managed properly, which I know we've made some changes there, that is an outlet for our citizens. It's a very safe one if it's controlled in the fashion that you discussed. The parks thing for me, you know, with the playground equipment, while I would like to think that people would, you know, pay attention, and I know a lot of people do, but I think there's times when, and we're dealing with kids. I've got 3 kids, and there's times where the kids might be doing stuff that, you know, are hard to keep track of. And I know it's a low risk population, but it goes back to, for me, do they expose the adults, and then the adults expose people that are higher risk? I understand we're in a time where people need that outlet and need to get out, but I thought it was a good compromise in Dr. Dart's comments to leave the parks open, but potentially block off the equipment, since that's an area that is less within our control. I understand your position on it as well. So that's one I think will be interesting to debate. I think it's one of the things we do need to debate as a council today is do we want to go to that step and leave the parks open but close the equipment? So if anybody wants to comment on that, I think that's a good place to start.
Yeah, I think that, I mean, I've got and 2 or 3 other comments. One, I would happen to agree, I mean, if we're going to err on the side of caution, you know, because we have a responsibility to try to make this as safe as a city as possible for people to live in without being cooped up as much as possible. My street, I live on 139th, and I've never seen so many people walking up and down the sidewalk as I have in the last 2 weeks. I mean, but you can just tell it's families, and there's just, you know, where there used to be maybe 10 to 15 a day, there's probably over 100. Not together, 2 or 3 going this way, that way. So I think getting out and exercising is imperative, or just getting out of the house is imperative, and there's not that many places to go, so I think parks are the place to go. But it's not the little kids that I'm worried about as much as those little kids that touch their hands, and they go touch mom and dad's hands, and they go over to grandma and grandpa's, you know, or whoever. and then it's the adults, so that can be transmitted in that way. I would like to see us, again, talk about, leaving parks open, but maybe, taping off and when you can, locking up the playground equipment. Again, if it's 2 months, then it's 2 months, if it's, and we don't know. There's no way that anybody can know when this is going to be over. There's no way anybody can know what's gonna happen, because this has never happened before. And I think I was shocked just yesterday, and I realize there are a lot higher, density. 500 people died yesterday because of COVID in New York alone, just in New York. 500 people. Obviously, we're nowhere even close to the density, but that's an astounding number to me, that we have a virus that when it's not contained and when it is being passed off, that people can die. I mean, this is not the flu. I mean, it is a type of flu, but it's not your standard everyday flu, because the transmission is it happens so much easier. But as far as getting back on parks, I like the idea of keeping anything that you touch, that's where the transmission is going to happen. And obviously that park equipment, that playground equipment, kids are touching it, they're not going to wear gloves. And then moms and dads, they're not necessarily when they get done, say, all right, come here, unless you wipe your hands off with a anti-bac, if they can get anti-bac. I think that's one idea. The golf course, I'm glad to see that we're doing stuff like that. I would like to see us take it even a step further and not give them the option and encourage one person in a cart, that they either walk with their bag, or they do one. I don't know if we have it set up. If we don't, we can change it to where they either walk the entire place, or they get one person to a cart. That we implement that. And then as far as the big box stores, I agree with people. I mean, there are people that are going to go to Lowe's just because they're bored, and they're going to go and they're just going to hang out just because they want to walk and browse up and down the aisles, and they're going to pick stuff up, that type of stuff. I would like to see if there's a way, because when this stuff started like last week, there was I went to buy Academy, and is there stuff in there essential? Yeah, they stretched it out and said, well, this is essential. And there was a lady in front, and she had a pad, and she was they were allowing X number of people in, and you couldn't go in until one person came out. Now, I don't know if we've got the authority to tell Walmart and Lowe's and Home Depot and Target and the stores that you have to do this, or if we just encourage them to do that. But I do like the idea of, if a family's got to go to Reese's, it doesn't take mom and dad. I know the kids want to get out and everything, but if you've got somebody at home that can watch the kids, whether it's mom, dad, or an older sibling, I don't know that you need to pile everybody in at once and go into the store to buy groceries. I think we could limit a lot of the number of people that are inside a lot of these stores by allowing just one person from that family to go in. So that's just some ideas to pick up.
Warren, is there, or really anybody on the city staff, do we have any numbers on what the big box stores have done? Vice Mayor Bush mentioned that Academy is limiting it on their own. And in large part, I look at this as many of the businesses in town have taken it upon themselves to make adaptations on their own without the city having to tell them to do that. Kind of seeing that it was going to kind of benefit the situation and flatten the curve. Do we know of anybody other than Academy that's actively doing anything to limit those numbers?
There are probably, and I'll call on Chelsea here in a moment to see if she knows, and there are probably people in the room that know from experience, but to my knowledge, we're not charting that right now, we're not calling. We did with restaurants, and we knew that it was about 50-50. About half the restaurants who are definitely making efforts to modify their services, and half, it appeared, weren't doing anything to modify their services. Chelsea, do you have anything to add there?
Resources limiting their, I'm sorry. Resources limiting their store hours, and then I believe that Mr. Wells is from Hobby Lobby, so they closed their stores down across the state on Friday, I believe, was it Friday? Wednesday. TJ Maxx across the nation has closed their stores, as well as JCPenney. We know that a lot of the national big box stores are doing that, are making that effort to close their stores across the country, kind of as they see the trend spread. As far as knowing any that are limiting numbers of people, other than Academy, that's the only one that we know of.
Sam's is limiting in the morning, they're lining up.
Got a question for Julie. Is that something within our power to regulate? As far as these box stores and any store for that matter?
Council, you're asking me if the council has the power to limit the number of people one of the big box stores admits to the interior at any one time?
Pretty much, yes. Do we have powers to regulate our private businesses like that?
You do, actually. I mean, you have the power to actually you have a great deal of power here. We're in the middle of an emergency. You declare an emergency. The council actually has tremendous power in that regard. So yes, I do know that other cities have either put that before the council or are talking about it, but this is not the first city to think about that. There are several that are contemplating taking action just exactly like that at this time.
Well, just to add to that, I would like to point out that there's two options here. There's an option for us to order that to be so, or to make that part of our recommendations that our big box stores consider that as well.
All I was saying was that Sam's is limiting.
Come to the microphone, please.
Sure.
I know that Walmart has put out on Facebook that one person, one cart to come in, so they're doing some of that. Research has lines throughout the store, 6 feet apart when you go in. I don't think they're limiting one cart, one person. Sam's has been, I don't know if you've seen any pictures, people lining up around the building in the mornings, mainly to get toilet paper, but they're doing 6 apart. But I went there yesterday afternoon to get something else, and there was just a free flow, but there was not that many people there. So there are some of those stores, grocery stores, that are limiting people's access to it.
And if I'm not mistaken, I think the morning time you're talking about Sam's is so that people up 60 and over.
Right. Well, and they're also doing 6 feet apart.
Right. Yes.
And that's when they get their toilet paper in too, so it's not all 60s, so yeah.
Well, Dr. Dart did mention this, I think, both today and the meeting before, that part of the flow of the big box stores does allow for social distancing because it's spread out over such a bigger area. So I think that's part of the reason why there hasn't been more of a movement to really strongly restrict. But it doesn't mean we can't make a recommendation. I think certainly for citizens it's been recommended, but I think we can, further and more strongly emphasize the one person at a time go in. Unless you're in a situation where you can't, we've got single parents that aren't in a situation where they can go to the grocery store and not have kids with them, and we certainly understand that. This is all about figuring out how to decrease the numbers that are in these buildings. I was in a situation where I had to go to Lowe's because we had something break at the house, and I had to run up there real quick, and I saw a handful of families that were in there. Now, Lowe's is doing a lot to curb the spread of social distancing. They built custom plexiglass dividers between customers and the employees to kind of help block spread, which I thought was unique and an appreciated effort. So maybe this just goes back to education, continue to get the message out. Look, you don't need to, everybody doesn't have to go up. We know everybody's kind of stir crazy, but let's either stay at home or stay in the car, let one person go in and get what we need to and get back out.
And Mr. Wells, my daughter and wife does believe that Hobby Lobby is an essential place, so just.
Well, it's so do I. I'm not here to speak on behalf of Hobby Lobby. But I think
You can't be on camera. We must have anyone who's speaking simply must be on camera.
So you got to
Okay.
Yes.
And that was kind of tongue in cheek a little bit.
I understand, and I'm not here as a fiscal capacity for Hobby Lobby. I'm here as a citizen of Owasso. I agree with you. I believe we are because of some of the things that we can sell for PPE equipment, things of that nature. But I'm just looking for your guidance on, so I can pass that information along to my bosses, and then they can take it on to whoever they need to talk to at this time.
Okay, any comments on any of the other items that we discussed?
One of the things I would like to ask is, what are we doing as far as, because my daughter works at one of the banks here in town, and the interactions that she has with the money that comes in, they actually have to take that out, put it in the vault for 72 hours. I mean, no one else can touch it, it can't do it, it has to sit there for 72 before it's then taken out and sent off to wherever they send it. And then they have to use new money that has at least been sitting there for 72 hours before they can actually get up people, so they're being very cautious. What are we doing for people that are taking payments and stuff at the water department? I mean, and can we, if they're still taking money and still taking cards and stuff, can we set that up to where nobody needs to come in and do that? They have a drop-off box so that that transaction doesn't have to take place?
Yes, we can. There's several things that we're doing, and we do have a drop-off box right now, and we're trying to encourage everyone to use that. There's signs on the building. We are staying open our regular hours. We have very much a skeleton crew at City Hall. There's basically one utility billing person because the demand has far decreased, and then there's one a person to answer questions about parks and also provide permits for community development. The person who's working in in utility billing has been briefed by our fire chief and our deputy chief over safe handling practices and sanitization practices. They have access to rubber gloves, disposable rubber gloves to change between each transaction. They are fully behind glass. There's just a small pay window slot, but we can certainly take advice. I don't think we take that much cash, but I don't believe that we're quarantining the cash for 72 hours, but it sounds like it might be a good practice if the banks are doing it. But those are some of the things that we're doing. Again, they are completely behind glass, which one of the utility billing people this morning said didn't like that so much when they first started, but they're loving it now. And we've talked about different ways to limit services, but really, as I expressed to you at the beginning, our goal is to maintain the highest level of services we can while never endangering our people. So we are taking some of those things into consideration, and we'll talk about those further things you mentioned.
Okay, anybody want to weigh in on shelter in place? And just to reiterate, we currently are under a mandate by the governor to shelter in place anyone that's 65 and older or at risk. What was discussed with Dr. Dart, what's been done by a few other communities around the Tulsa metro area, is to issue a shelter in place for everyone. It sounded like to me Dr. Dart was very much in favor of that, thought that would help slow or flatten the curve, if you will. So we need to take up that item and kind of get everybody to weigh in on that.
So is it shelter in place as opposed to the safer at home?
Safer in place.
Yeah, no, the safer in place. We're asking people to do the same thing. It's just that shelter in place, you can be fined, or you can have somebody that can say, yeah, you can't do that. So there's not really, I think it comes down to enforceability on a shelter in place as opposed to a shelter at home. I think it's the same thing. It's just that now are we going to ask the police to say, all right, you need to start enforcing this when you don't see it happening. To me, I think the thing we need to do is just really watch for those gatherings of 10 people or more. If people are purposefully getting out in a big group, because, I don't know how you're going to ask the lady that's driving down the street, are you going actually to get groceries, or are you gonna go get your drugs, or your pharmacies, or, you know, your pharmaceuticals? I mean, so I don't know, I mean, is there a difference other than enforceability on a shelter in place and a shelter at home?
I don't think, I think it's semantics, I think it's education, is my opinion on it. I think, if my opinion would be if we come up with a shelter in place, it's more of a resolution that we would add on and say we are passing through the recommendation from the Tulsa Health Department. They are recommending that everyone shelter in place. I agree with you, it's unenforceable. I just don't think there's a way you can monitor that situation in that way. We certainly educate people that that's what we need to do.
And I would also make a point, not only is it unenforceable, I mean, we could never efficiently or effectively enforce those kind of rules anyway. But in addition, if we tried to, we're asking our police force to pull themselves away from other necessary emergency type situations to enforce these rules. And I've talked to the chief, and he expects, you know, when you confine people to their homes, when you take them away from their employment, stress, crime's going to increase. So those demands are going to be placed on our police force. Now we're going to ask them to do some other aspect of law enforcement in enforcing these rules. I think it's the way to spread our police force way too thin.
As far as the criteria for a shelter in place, are we saying then that you basically are not able to leave your home? Is that really what the bottom line is?
You know, the extension of the safer at home, if that's the terminology that the governor used, and if you go by what the city of Tulsa came up with, I'm going off the top of my head here. You got it? You want to go ahead with what Tulsa stipulated?
Sure, I could clarify. Tulsa's order says all citizens living in or visiting the city of Tulsa are ordered to shelter at their place of residence. There are 5, this order allows residents of that, people in that residence to get out for essential activities, and there are 5 of those essential activities. 1, to engage in activities, perform tasks, or obtain supplies essential to their health and safety, the health and safety of their family, those living in their residence, or pets. So medical supplies, medication, food, beverage, other things for the safety, sanitation, essential operation of the residence, visiting a healthcare professional, obtaining supplies needed to work from home, or performing property maintenance. So that's the first essential that you're allowed out for. The second one that you would be allowed out for under the Tulsa mayor's order is to engage in outdoor activity, provided that individuals, except those from the same residence, must comply with physical distancing requirements of 6 feet. So if you're welcome to get out for outdoor activity and exercise. The third essential activity is to perform work at one of the essential businesses, so you can go to and from work if you work in one of those, quote, essential businesses. The fourth allowance is to care for or transport a family member or pet in another residence, and the 5th is to move to another residence.
So essentially, the way I hear that is we're still recommending people do what we've been recommending since the get-go, and you can still get out and do all the things that we've kind of allowed for in our current scenario.
And the thing that doesn't really make a lot of sense there is if you're having a couple go out and walk, you're going to have a couple go out and walk, and they're going to be 6 feet apart, but when they get in the house, they can be together. It doesn't make a lot of sense. You know, I'm not sure that you're going to ask families to walk.
It actually qualified that. I know I didn't explain it very clearly, but it qualified that if you're from the same residence, you can be close together. But if you're not, you have to be 6 feet.
I think the biggest thing to me is, one, if we could encourage the big box stores to. I like what Research is doing. 1 person, 1 cart. You don't need a whole family going into because that would just cut down on the people. Same thing. Whether it's Lowe's or, you know, of course you don't necessarily have carts going into Lowe's, but you still, I think if you try to limit to 1 person per family going into Lowe's. And then as far as parks, you know, I like the idea of not allowing the kids around the playground equipment. And I think you just, you know, even though it's gonna, you can't really enforce it, I think we've got to reemphasize, you can't have a group of 10, or you have to be in 10 or less in a group. You can't have a group of 20 people out having a party down at Rayola at the, at one of the covered patios down there, having a big picnic or something.
Which is obviously currently state order, and, I think it would be enforced in a nice way. I think it would be, somebody would say something and then stand up, get one and 10 out. I think we're doing that currently. So I think really it comes down to, the health department recommends the safer in place for all ages. I think what we've established here, without maybe really saying it, is the communities that are doing it are just saying, this is what we recommend. It's not something anybody's really going to be able to track down to the individual. So, does this look like we agree on this, and then put out some sort of informational piece through the city website? Obviously, we write up, whatever edition we're going to vote on, if we all agree on that, and then educate, get the information out there, and let people know this is what the expectations are, this is what we're doing, and circulate that as much as possible. I think this is much of an education issue as anything.
I agree. I think it's got to be incredibly clear. I think people are so confused, including businesses. You've got the no dine-in option. Well, how many people can go in and pay at one time? To me, I just think there's a lot of confusion wrapped around it.
Agreed.
I guess one other question I had in regards to the safer at home businesses. The governor, of course, had his executive order, and then I know we're kind of pointing to what Mayor Bynum in Tulsa put out kind of a more or less an amendment to that, it sounds like. I guess I'm trying to figure out, what's the distinctions there? What are the major things that stood out? And I know you kind of went over that, some of that there, Warren, but still, is there anything significant that GT was looking at there saying, whoops, the governor overlooked this? Or was there something in particular that he pointed to that the governor didn't?
The two things.
I know it's a loaded question, but I'm trying to figure out, because in reading, I've tried to catch up on, it's a pretty long executive order, and there was an amendment, of course. I feel like that there was a lot of the same from what GT pointed out, except for the age part, where everyone of all ages.
Okay, thank you, Counselor. It's a good question. The two things that really stand out, aside from the Tulsa mayor, whom I have a great deal of respect for, but aside from him making it a Tulsa executive order versus a state executive order, the two things that were really different and above and beyond were the all citizens safer at home, which he calls shelter at their place of residence, all citizens, whereas the governor had just said 65 and older at risk with underlying health conditions. So the mayor of Tulsa expanded that group drastically. And then the other large thing was item number 6 in his executive order. All city-owned sports courts, golf courses, sports fields, and dog parks are hereby closed, and use thereof and use of any fitness equipment, playground equipment, or shelters within city parks is prohibited, even if not locked, gated, or fenced. But then there's a clause where he said that parks would stay open, but not sport courts, golf courses, sports fields, or dog parks. Those are the two main differences: closing of playground equipment and sport fields and golf courses, and extending the safer at home to everyone.
Okay, that helps. Thank you. And of course, I guess that leads me to the question of our dog park. Is it still open? Is it still operating?
It is.
Okay. Thank you.
I think pertaining to that, again, I've said this from the beginning, and I don't speak for everybody else. I think in general, we've all been in agreement on this, that while there's a lot of opinions on either side of this, the opinions of the experts have all been pretty consistent. That's why we had Dr. Dart here today and asked him questions about these specific things. Again, I was pleased with some of the answers. Some of the answers, frankly, were a little bit scary as far as the longevity that we're looking at this. And one of our citizens asked this question. I think it's a very good question. You know, what is the end point of this? You know, what's our exit strategy? And I think for the large part, we don't know that. You know, we're going by the projections. Those projections were longer than I had originally heard, and again, I trust the expert on that. But I guess my answer to that is we're going to have to evaluate that each subsequent meeting, kind of talk about where we're at, and kind of go from there. Julie is flagging me that we've got one more person that's signed to speak. Is that correct?
Yes, sir. Tim Ryland.
Welcome, Tim.
First of all, thank you very much for taking my comment afterward. Something you guys may not know about, a lot of people aren't taking this seriously, and I think that was one of the reasons that Mayor Bynum actually did the amendment to Governor Stitt's Safer at Home, because people are just out and about doing whatever. Unfortunately, like, you know, you see me with my mask and my gloves on, when I go out in public, literally every time that I go, somebody coughs at me, or coughs at, just this morning at the come and go, somebody coughed on the door that I was going to open, you know. So people are, not only are they not taking it seriously, but they are, you know, actively trying to, you know, make a point, I don't know. But the reason I think it's important is because some people aren't going to take it seriously until you guys make a decision that's almost to the point of being extreme, so that you're making a statement and not just initiating some kind of rule, new restriction. Because as we've seen with all the cities, they all go the same path, and it ends up being the same thing, almost a complete lockdown. So, you know, it's like we're going in these little baby steps because we've never done this before. America's never seen something like this. So a lot of people don't know what to do, but, you know, you look at what has already been done, what has been successful in preventing the spread. You look at places like Taiwan and Hong Kong and what they did, and they have very low, you know, CFR rates. So I'm not saying lock the whole city down, but keep that in mind that people are literally, like, you know, coughing at me and making remarks and, you know, doing stuff. And another thing is that it's been young kids mostly. If they don't know they're sick, we know that it spreads asymptomatically. If they don't know they're sick and they're just joking around coughing on something, they could be spreading that, you know, more likely so than if they were just talking. So just because they think it's a joke and they're not sick, they could be spreading that, and, you know, they don't even know. So people in Owasso are not taking it seriously, and the person that come and go was a worker. So, you know, so I guess my suggestion is, you know, keep that in mind when you place the restrictions. And we're going to probably end up being at a very restricted state at some point in the future, because the exponential growth is just going to keep going until we, you know, do something to make it stop. So thank you, I appreciate it.
Thank you for your comments. Any other comments from the council before we start to collate this data?
Yeah, I will say that I mean, because when I drive around Owasso just to look at different things, for overall, I think Owasso's done a really good job. I think the citizens have done a really good job. I think I mean, you look around, there's a lot of empty parking spaces, a lot of empty parking lots. There's a lot of people staying at home. And the only way that you're going to do a complete, I mean, unless you quarantine the city, even if you had as strict the rules as you could, you're still going to have people that are going to be stupid. I mean, they're going to do dumb things. But I would like to compliment the citizens overall, because I think they've done they've taken it apart. I mean, I've not, I've heard that people have seen big groups. I've not seen it, and like I say, I've not seen a large congregation except at the big box store. So that would be my only thing that I think we need to really tighten up as a way to try to restrict the number of people in the big box stores. Other than that, I think it's been, and the grocery stores, I think it's been pretty good.
I think it's worth stating in addition to that, I think most of our citizens and our businesses have gone over and above without requirement. Granted, there became a part where we had to make requirements because not everybody was doing what they needed to do, but a large percentage did without anybody asking them, and I think that speaks to the quality of the citizens of Owasso. I do think people struggle with understanding how severe this is. I mean, make no bones about it. This is one of the scariest things we've ever seen. And anybody that hasn't recognized that to this stage with all the data and the numbers, I mean, we had 0 cases here 3 weeks ago, and now we're up over getting close to 600. And based on the projections, we're going to be over 10,000 in another 3 or 4 weeks. So this is real. It's affecting lives. It's an impactful thing. But there's an art with which you can get citizens to realize that. I mean, it's in the U.S. now. It's close to us. It's closing down on us, and you still have people that don't believe this is going to happen. We've always gotten through this stuff before. We're going to get through it again. It's not going to affect me. So to the speaker's point, I agree. You're always going to have people that are in that mode, and we're not going to be able to, in my opinion, force those people to not do those horrible things they're doing. Anybody that would cough in somebody's face that's wearing a mask, I think should probably be arrested. I mean, that to me seems like a criminal act, especially in the scenario we're in. And unfortunately, we're going to have people like that. I think there's also an escalation as this grows and we continue to make the responsible changes that we know to make based on the experts' opinions. And as people see this start to close in, people will get more and more scared and more serious. Our job is to legislate what we can responsibly control and educate the rest of the way and get people to understand this is real and that we're serious about it and that everybody needs to be serious about it. And that's going to go with some decisions we make today. I still go back to the safer in place has to be something that we strongly recommend. I'm in agreement that it cannot be, we just can't realistically enforce that. We're just going to have to educate and lead by example and hope that we reach more than we don't at this point.
I do feel like using the terminology shelter in place as opposed to safer at home just drives home a little bit more seriousness to it. And then with the box stores, I see a whole lot of just careless, I don't even want to go into them.
Doug, you had a comment?
Yeah, I just was going to concur with what you were saying, and it is a overwhelming effort that's got to be taken to educate folks on everything that's taken place up to now and what the outlook's going to be in order to get over this thing. One thing I was going to also add, and this is going back to what Warren went through, he tried to differentiate what Mayor Bynum's part was versus the governor. The governor actually says in his, I'm reading now out of his executive order, it's like third page, number 17. Basically, it says that adults over the age of 65 and people of any age who have serious underlying medical conditions. So it does cover everyone that of all ages. I mean, it just differentiates that has serious medical conditions. The point I'm making to that is I know some of the citizens that I've gotten comments from, that is an issue for them. They have they've got issues with their basically being susceptible to be able to catch the virus easily. They don't have a very good immune system, so that's something that needs to be, folks need to be understandable to, is that there's going to be folks more sensitive than others to this, and they need to understand that, and certainly not be acting a fool, coughing in people's faces that perhaps maybe have that issue or just concerned about it. So anyhow, I think it's worthy of just pointing out that it is a overwhelming effort to educate folks on just how they need to be sensible in these times, and be sensitive to others that have issues that maybe we don't, or that the average person doesn't, in order to live around the virus. So anyway, that's just my comments to that. Certainly see that we probably need to take some form of recommendation actions here to ramp what the governor's done, and it's just a part of the progress of the disease or of the virus that we need to follow.
Yeah, I agree. Good comments.
Changing, Councilor Kelly was talking about, she likes the shelter in place as opposed to safe at home. If you change it to shelter in place, what actually changes?
I'll answer that. I don't think anything's going to change. I agree with Councilor Lewis. There's a lot of confusion because you've got stuff coming from the state. You've got different cities coming up with their own version, and I think citizens in general are confused. So I think a big part of this is we determine what we want to communicate to the citizens of Owasso, and we can do we can write it down and we can vote on it. But until we put out the information in a cohesive way that our citizens have access to and are going to see, there's going to continue to be confusion. So I think we need to dial this in what we think it should be called. But then I don't really think it matters what it's called. I think it's what we explain and the information we put out is here's what we're doing here. Here's what we expect to keep everybody safe. So we have to follow up on this. We just can't make a proclamation, in my opinion. So if my job here is obviously to kind of take all the information and coalesce it and decide, is there an action item that needs to be taken? What I've documented so far, and I need for you guys to jump in where you object or not, from what I'm hearing from the comments so far is there seems to be some interest in not ordering, but recommending or further reinforcing that people going to these big stores go in one at a time, with some potential discussion with the stores to kind of help support us in that effort. There was also some discussion about limiting the number of people in the stores. I feel like that kind of faded as we discussed, more in favor of letting the stores control that with the methods they're using and us educate on our end, saying one person at a time. Does that seem pretty consistent with what everybody heard?
And that recommendation of one person at a time, that's not only an encouragement to the big box store, but to people in general.
Absolutely.
Don't go, just one person from your family go.
Yeah.
That affects you, that affects everybody else that's going to be there too.
Correct. With the stipulation that we understand there are people that cannot do that. Single mothers or single fathers with kids are going to have to. But to the extent that you can go on your own, I think we should make that point and make that very strong.
Limit the number of family members that go, to the greatest extent you can.
Correct. I think maybe having Chelsea do some outreach to the stores that most people are concerned about, which by my count are the big grocery stores, big retail stores, doing some outreach to those groups and see if they are interested and we can compel them to comply with the limiting the number of people in the stores, to follow Academy's lead, which I think is an excellent way to do it. In addition to that, these stores all have the capability, their infrastructure is set up and ready to go with all these stores to do online ordering. So you're shaking your head.
There are no available times to online order at Walmart or at Reese's.
Right.
overloaded with that.
So I've heard that too. So what my concern is there is that there is an adaptation that could be made there, and it just hasn't because there's been some overwhelming things going on, but the infrastructure is there, and I believe they could make that happen. We've seen restaurants on a dime just change the entire way we do business and do takeout, delivery. My business, we changed on a dime. We did the emergency declaration one day, and the very next day we closed our building. That normally has hundreds of people going through it every day, and worked out a way to do it outside. What I don't want to do is limit people's access to groceries in any way, shape, or form. That's the furthest thing from what I want to do. But I do think working with the managers of these stores, and hopefully Chelsea can do something that establish and work with them on creative ways to get people in and out of there in the safest way possible, is the responsible thing to do. And I think there's some work we can do there.
And I think the biggest first step is saying one person at a time.
Yep.
Unless it's just not possible. I mean, I think that's huge.
Can I just say, I have a really strong concern that we already have recommended some things. And I feel like recommending isn't working, didn't work, isn't working. And so I don't know, we don't need to take a little bit stronger stance.
But well, just because I'm not familiar with it, because I don't get shot, like what, for instance, where it's not working?
Like people piling into, say, Walmart, for example.
Well, I don't know that we've ever, I don't think we've ever implemented it where we're saying we need to have one shopping cart per person, or one person per cart, going into Walmarts and stuff. Because I mean, just like when we did the restaurants, drive-in, they closed it down. As soon as we said, you cannot have dine-in, but it was done. Non-essential, and a good example is the tag agency. I took on my way over here, drove past the tag agency, and they were out the door spaced. We didn't tell them that they had to, but they were out the door spaced 6 feet apart. But because I don't get out except to go to the grocery store or whatever, and I didn't know that Research had, or the Walmart didn't start the one person per basket. But I think, again, I don't know, Julie said we can enforce it, we can say this, but then, we can demand that, but then it gets back to, are we gonna have the police standing out there watching people, and the first time they allow 3 people in, are they gonna stop them and say, okay, I'm gonna give you a fine for allowing that to happen?
I just feel like if we don't come from a stance of being extremely serious about this, then that's going to flow down. People are not going to, the stronger that we take a stance, I feel like the more serious people are going to take it.
I agree with you. The one area though that we really haven't come out and made any strong recommendation at this point is this area though. Everything that we've done so far that's been done on a state level, it's been done on a city level, we've never really addressed that issue. We've left them handle it. We haven't even made a recommendation. So I think in this scenario, because some have done it on their own already, I don't have any idea how amenable some of these stores are going to be to make changes based on us talking with them and making recommendations. But I think because we haven't made that statement yet and haven't asked them to do that, maybe worthwhile trying and see if they comply. And again, I want to reiterate, when you listen to Dr. Dart, he does agree that those stores should stay open and continue to function, and that they do have a little more leeway based on their space and ability to space people out. And I think that's why they've kind of been left out of the discussion in large part, because there's a lower chance of transmission in that situation, because people aren't just sitting static. That was his big thing with the restaurants. You go in, you sit down, you're static, smooth surface, right? You're going into, a big box store, I've got hand sanitizer in my car. I sanitize before I go in, don't touch anything, or I don't touch my face. I just am conscious about that, and hand sanitizer when you get out. When I was going, I don't know if I'm going anymore. But things like that are going to go a long way towards preventing infection in yourself. I think maybe we give them a chance to see if they'll comply with some of these things, in addition to the things they're already doing. Another thing I'd say is, to my knowledge, is there a precedent yet anywhere with anybody actually ordering any of these larger stores to limit their numbers?
I could give you, I'm sorry, but I neglected to mention in Mayor Bynum's order, because it's in the form of a recommendation, I didn't mention it earlier, but he does add that to his most recent order. He says this, item number 5, to the greatest extent feasible, all businesses shall comply with physical distancing requirements, including but not limited to maintaining 6 feet physical distancing for both employees and the general public, offsetting shift hours and or days, and requiring employees to conduct work remotely where feasible. So to the extent feasible, he's making a strong recommendation here and not ordering it.
So I think that's a good model to go by, at least since this is our jumping off point with this group, would be my recommendation. We meet again next week. We have a natural meeting. I know we've called a bunch of emergency meetings and special meetings lately. But we've got another meeting next week where obviously we're going to sit and talk about this again and maybe reevaluate at that point. What are your thoughts on that?
I am not necessarily saying that I think we should mandate for the stores to do anything. I do like the idea of working with managers on that. I think I'm more concerned with what we call it. If we say shelter in place, people are relating that to a stricter behavioral pattern.
Okay.
That's what I'm saying.
So on that item then, so leaving the big box stores, I think we're going to make a strong recommendation there. On that item, the recommendation is going to be that we're going to strongly recommend a pass-through recommendation from the Tulsa Health Department that people of all ages shelter in place. But again, not with an expectation that anybody's going to be waiting at your front door and asking you where you're going and follow you over there type of thing. This is more of, this is what we're doing, this is what we recommend that you do to flatten the curve and make this go away quicker. Does that sound like a...
Yeah, I'm just concerned that we...
Yeah, that sounds reasonable. That sounds reasonable to me, and I want to concur what I think you were referring to earlier, Chris, about what Dr. Dart was saying. He actually, I thought, somewhat complimented the box stores for trying to come up with ways to keep aisles separated so you can kind of tell if you're 6 feet from the next person. And I think that's the making sure that our box stores here are doing the same thing. My guess is that the bigger ones are. It may be just trying to educate the smaller ones to do the same.
Agreed.
So are you saying change the order from safer at home, which it currently is, or shelter at home? What are we currently talking about?
I'm saying that's on the table at this point.
Yeah.
I'm getting stuck on the semantics here.
Or sorry, is that, I mean, so right now, Samantha, you're suggesting we change it to shelter in place?
That is Kelly's recommendation at this point for discussion.
That's just, council is making the statement that that's a state term, safer at home.
So meaning that we would just have to add to the safer at home as opposed to come up with a shelter in place.
It wouldn't be a change to any current resolution that we have. There's nothing like that the council currently has approved. So this would be a brand new resolution saying, if I'm understanding correctly, that you strongly recommend either shelter in place or safer at home, and then how you choose to define that.
Correct. So Councilor Lewis is basically saying she feels like shelter at home is going to speak to people more directly. So when we do ours, we would strongly recommend shelter at home for all ages, regardless of health status.
Correct.
Okay.
And I'm guessing you mean shelter in place? Okay.
Yeah.
Is that not what Tulsa did?
It is. That's a very common term now.
Any other comments on that?
You know, I'm kind of ambivalent about the particular term. We're going to have to delineate and define what we mean by that. That's we're going to have to be careful about.
I agree. I think it's, we're sitting here talking about educating our public. I guess we need to really spell that out.
Yeah, I think part of what goes along with this, at least in my eyes at this point, is once we make this decision, it's followed by a public education campaign, however that looks like. It's probably going to be low production value since it's going to change frequently. But the important thing is to get the information out there. So do we feel like that continuing on with safer at home is going to be easier because everybody understands that based on what the governor stipulated? Or do we feel like the shelter in place and a redefinition of that is going to reach more people is the question we need to answer. Or are we going to confuse more people, or is it going to make it clear?
I don't know that it's, again, I don't know, I mean, it's semantic, shelter in place, safer at home. It's, our resolution spells out that we've already had in place, spells out what we expect, right? And regardless of what we call it, the resolution hasn't changed. Nothing's gonna change in the resolution except what we amend here.
Well, you're not amending, you don't currently have any kind of a resolution that requires safer at home or shelter in place. So you'll have to define that in a resolution. Now, what you can do is link it to the governor's order and use the same meaning. But this will be brand new terminology for a City of Owasso resolution. Does that make sense?
Yeah, that last, correct me if I'm wrong, Julie, that last resolution that we did, a couple weeks ago now, that's pretty much extinct. I mean, it doesn't exist anymore. It doesn't have the value just because what the governor did came out with later.
It still exists. If the governor were to withdraw his order tomorrow, that order would still be in place until the cutoff date or until such time as the council took action.
Which is April 14th, I believe.
Yes, and that covered the non-essential businesses.
Right. So it's going to be up to us to define it. Whatever we call it, we're going to have to define it after the fact.
Whatever we call it, all the responses I've heard from residents and citizens is, it kind of boils down to this simple thing. If I'm out in my car, am I going to get pulled over and deported? So we need to define it clearly enough that people understand that that's not what we're saying. But these are the things that we think are important for your own safety and other people's safety that you do.
And I agree, and that's what it comes down to, is defining what we're saying. Here's what you have to do, not what we call it necessarily. Because Tulsa's shelter in place is different than New York's shelter in place, which is different than Boston's shelter in place. That just happens to be the terminology we're using. But I think what we have to do is we have to define, here's what's required of you as a citizen of Owasso. Spell that out, and whatever we call it. Shelter in place is just a term that different cities have come up with. Because we're not going to do what GT Bynum has said he's going to do. That's not our responsibility to say, okay, well, let's do what Tulsa doing. We have to do what's, in my opinion, what's best for Owasso to do.
We're doing what the health department's recommending.
Right.
That is, I believe, our driving force. So.
But I mean, like GT, I mean, it's closing down all the golf courses, closing down, all the parks and stuff. I mean, then he did back off that, so he can still walk. There are things that we're not going to do that, that he did do. But I agree, it should be what health.
Okay, so since we're going to define it after the fact, I'm going to just propose for now, we can change it when we come to vote if anybody has any more thoughts on those. For the purposes of the city putting together the information, let's call it shelter in place, that's the common terminology, right? And then we'll define that after the fact. When in the educational pieces, we'll get that defined. From the standpoint of parks, what I'm hearing as a general agreement is parks, including golf course, stays open, but we are going to shut down the equipment. I think I heard support for that, but now's the time to speak on that or not. Does parks stay open?
I don't know, have it listed as the no cart thing.
I mean, for me,
Or the one person.
They're already doing that.
Yeah, I don't know.
yeah, they're currently doing the one person per car.
I couldn't tell you for for sure that they're mandating if it would be easy to mandate.
Okay.
And are they like sanitizing the carts after every golfer or?
Yes.
Okay.
The thing with golf, and I don't play golf anymore, Warren's got a fair amount of golf experience, but, I mean, if there's anything tailor-made for this situation, it's, no pun intended, tailor-made is a golf term, I just realized. But really, for this virus, I mean, you've got groups of 4 that, if you have them each in their own cart, they're using their own balls, their own equipment, and they're in an open-air environment, so. It is a way for people to get out, as long as we sterilize the carts, which should be a fairly simple thing to do. I think it's just another, again, speaking to Dr. Dart's comments, it's a good way for people to get out, get fresh air, and not go stir crazy.
I mean, I'd have to agree, golf is kind of the one kind of endeavor you might be able to safely participate under these conditions, because distancing is kind of part of it.
So that does raise questions. Sport courts, we do have a tennis court and just one. The school has the majority of tennis courts. The dog park and the splash park features. So you said playground equipment, cordon that off, and I totally understand that position.
Yeah.
Splash park, turn off the water.
To me, the splash park falls in the same line with the playground equipment.
Because you've got kids right there having to turn the water on by touching on and off. And so.
As much as I don't like doing that, I feel like that was Dr. Dart was pretty strong on that.
Dog park.
I think dog park stays open. That's just an
What would cause
area.
people to be in close proximity at a dog park? I mean, I'm just.
Usually dog owners hang out together and talk. But, I mean, they could, but they could certainly have the responsibility to practice social distancing.
I agree that I don't see weekend using the dog park to the same.
Skate park, there's not really anything there that they touch, is there?
Not really.
As long as there's no more than 10 at a time, and again, then you have the enforcement thing. Yeah.
Do we get them all?
Yes.
Doug, do you have a comment?
Well, I had more question on, and this is my ignorance about being out at the dog park. So there's not, I thought I heard, and maybe I misunderstood, there's not anything out there that can be handled, like gates or things that potentially people could contract the virus in some way.
That's a good point. There are gates. You have to walk through a gate.
Yeah.
And again, I'm trying to put some distinction here, find some distinction, I should say, compared to the other things we're doing in parks. And one of them is the playground equipment. There's things that could be touched where you could contract the virus. Same with the water features at the rail and others. I guess I just wonder what we are saying here with not shutting down the dog park.
Can't we just open the gate and have it left open? You know?
The only distinction I make, and this is a small distinction, and I'm just kind of talking out loud here. The issue with the playground equipment is frankly kids and kids touching it and not knowing what they've touched and bring it back. My assumption is with the dog park, usually you've got an adult going in, so much like if they're going into a store, they're going to want to hand sanitize before and after, and there's a little higher expectation they would do that. Again, that's just me thinking out loud. It's a good point though. I mean, there is a surface to touch there, but it's a one-touch in and out type of thing as opposed to playground equipment, you're kind of all over it. So it's.
I guess in order to try to compromise on that a little, in order to perhaps give some confidence to folks that maybe think, well, you're not distinguishing well here, is to say we'll put up, extra signage, but do something that kind of sets apart the changes that need to occur there, like maintaining distance and do not touch certain surfaces or I don't know. I'm trying to find something to try to help with that, but that certainly there's some variables there.
I don't think there's any lack of awareness in the general public about those kind of issues right now. And we can't give the false assurance that we're offering 100% safe zones. The dog parks aren't 100%. The golf course isn't either. And the parks aren't 100% safe. We can't give that kind of false assurance. We can just give clear outlines of what people should be doing, how prudent they should be acting, and ask people to be responsible.
Yeah.
Is it realistic to put hand sanitizer out in front of the dog park? That's just gonna disappear.
While you're considering this, there's.
Well, dude, going back to the distinction, I'm sorry, I'm walking over y'all. Go ahead, Warren.
Just real quickly, while you're considering this, staff has raised a very good question about restrooms. Should we close the park restrooms? Because you can't be in there after every person, so it's another situation. The unique thing there is you're going in purportedly to wash your hands and be sanitary, but.
Yeah. I tend to agree that you probably should.
Should
wash your hands or close them down?
No, I mean, you probably should close the restrooms. Again, you don't know who all is going in and out. And what I was going to touch on with the dog park, and this sounds a little extreme, but do we just limit it to adults? I don't think you can have kids at the dog park, right? Walk your dogs, or is it just adults only?
Yeah, anybody can go in there. Bathrooms are tough. I almost more the other way, that I think you want to have access to be able to wash your hands.
Yeah, I think then you encourage them to wash their hands.
Yeah, I mean, I agree with Lyndall, there becomes a certain point where it's, you can't protect against everything, right? So I think bathrooms would stay open, would be my thoughts.
I agree.
Okay.
Glad somebody brought that up, that didn't cross my mind. Okay, so we cover all the parks?
Tennis court, Young Creek,
Quotes. Dr. Dart was kind of anti-tennis.
I'm not sure.
I mean, not anti-tennis, but he was a little more concerned about tennis than he was golf, and for understandable reasons, but it's a small court, you're not gonna have more than 10 people out there, right?
I think he's talking about using the same tennis ball constantly back and forth.
Yeah.
Usually 2 people, sometimes 4.
Thoughts?
I think it's cool. I mean, usually you know the person you're gonna go play tennis with, and you're gonna probably have a reason with them to the court. I mean, I don't know, but kind of gets back to your, how you want to be in a bubble. So, I mean, I don't play tennis either, so it's not,
If we give, if we delineate our expectations and the seriousness of this virus and how it's communicated, let people make decisions about tennis courts on their own. I mean, they're following our guidelines, or they're listening to them, and then they'll make a wise decision. I mean, do we want someone patrolling the tennis court? I mean, check in, or citizens calling and saying, hey, somebody's on the tennis court, can we get rid of them? I just think we're creating obstacles to the efficient response to the situation.
So what are we down to? We've got tennis courts.
We're just deciding on tennis
not
courts right now.
Tennis courts, golf is good. So we're just closing essentially the playground equipment.
Yes.
Is what we're talking about.
Splash and the splash.
So then get back to the equipment.
so that people can still get out and exercise as much as possible.
I see anything wrong with tennis courts if we're going to leave their stuff open. Everywhere's going to have services.
Yeah. It's okay. So, tennis court's okay, and we'll put that as part of our educational piece. Let's see, so we did big box stores, parks, shelter in place, we talked golf courses. I think we've hit everything. Anything we missed?
Not from my notes.
Okay, so the next question is, what time tomorrow is good for everybody?
I'm in Pojo tomorrow, so
Okay,
I won't be available. Unless you do it late.
Do you have the ability to call in?
I will be on site,
Maybe give us
possibly. I'm supposed to be down there, they're supposed to start training at noon, and it could be noon to 4, I don't really know. If we had a set time, problem is, I don't know how long the meeting would last, so.
If you maybe shot for 4, there might be a chance that you'd be done as 4 work for the other counselors.
earlier is better for me, but I can make anything work. Just gotta move some stuff around.
Okay, if we're talking tomorrow, it'd be difficult to have something drafted until probably at least as close to this time tomorrow, 2, 3, 4 o'clock.
Okay. So
Does 6, does later work for you?
No, it's, yeah.
Like a 6 or 6:30?
Early evening's kind of tough for me tomorrow, but I'll make it work. How's everybody else feel about 4 o'clock tomorrow? Doug?
What was the time again, 2, did you say?
4 o'clock tomorrow.
4, same time as today?
Yes, sir.
I will need to call in again though.
Okay, anybody else need to call in?
I would have to.
Okay, so we'll get 2, so we'll have to list you 2 and then 3 of us plan on being here. Okay? Okay? Good discussion, everybody. Appreciate everybody being here. With that, I need a motion to adjourn.
So moved.
All in favor?
Aye.
All opposed?
Aye.
Okay. Thank you, everyone. We'll see you tomorrow at 4 o'clock.
Thank you all.
Vote. Thank you, Doug.
Thank you.
Yes, sir. Good job.
That worked very well.